Dr. Doug, as a pediatric dental specialist, you must have so much fun with children.
I do. It's a lot of fun, and we have a great time here. It's a good job.
Well, it's an interesting thing to think fun and dentistry because people don't normally think that, but you walk into your office here in Logan, this is the funnest, colorful, bright, and friendly atmosphere.
Well, and that's part of what we do is we make a great environment for the kids, and we just want to make sure that it's fun and happy and they have a great experience here, and so we're really set up to do that.
Well, it can be a rather traumatic ordeal to go to the dentist, and so you do make that. Now, one thing I've learned this morning is that it takes a specialist, pediatric specialist, to work on children, and I did not realize that.
Well, and that's what we do. I mean, I'm a pediatric dentist, and pediatric dentists are specialists, so it's just like, say, another specialty in dentistry like orthodontics or oral surgery. We are specialists. We've had extra training. For example, after dental school, 4 years of dental school, then most pediatric dentists will go to pediatric specialty training for another 2 to 3 years after that to learn how to work on children. It's kind of like your pediatrician as opposed to, say, your family physician.
Well, I love it as we get more technology out there and better informed, because that wasn't the case when I had little children. My children are 20 years old, so beyond that. But now there's better care for our children, starting as young as?
Well, my youngest patient ever was 2 days old, born with teeth, and so we start from 0 and we take children up to 16. So my philosophy is kind of, if they can drive to their appointment, they graduate and they go on to the family dentist. So
that's fantastic. Now, to switch a little bit, do you even help with kids with special needs?
Yeah, we do, and we take people with special needs of all ages, and so they don't have to be under 16 to come here. And we do that.
I like that idea too, because again, it's a comforting atmosphere, and people with special needs might need that as well. And I can really relate to that because of my son. Being in here, it feels good, and so I know that he would feel more comfortable in getting in the chair.
Yeah, and that's kind of the consensus with all the kids, and really is it's a comfortable, very, very relaxed environment, and it puts them at ease right off the start. So. Okay,
so now that the kids, you can get them at 0 if they have teeth, are there issues that we as parents should look at, and then if not, when do we really want to bring them in for their first visit?
Right. Well, starting, right from the start, they're going to see their pediatrician, and their pediatrician, most of the pediatricians here will refer their children to a dentist at an early age. Kind of the new recommendation now is to have your child come in to see the dentist between their first tooth in a year, so at least by a year at the latest. And that's kind of a new recommendation within the last few years. Kind of the old school train of thought is, 3 to 4 years old to come and see the dentist. But now the recommendation by the American Academy of Pediatric Dentistry is a year, at least by a year.
I love that. Better teeth, better health for their childhood. Exactly. And then from there, is it every 6 months like it is with an adult?
It is. It's every 6 months unless, we see specific issues that we might need to see a child more frequently. But 6 months is usually the standard. So.
Okay. Well, I say don't wait for your pediatrician to recommend Dr. Doug. Recommend Dr. Doug, or tell your pediatrician that you're going to Dr. Doug, because I am so impressed with your facility here and the staff that you have.
Well, thank you. Thank you. And like I said, we're set up to see children and just make everybody at ease, and it's a fun place.
Well, I know that your wife helped with the decor and the atmosphere feeling. Now, is your staff specially trained as well to work with children?
They are, and we really go through a good process. Hiring our staff, we look for the right people to come in who are great with children and have a good attitude and are just friendly and fun. And we go through an extensive training process, a little child psychology, so to speak, mixed in there to just help them with associating with the children and communicating with parents about their child's specific needs. And so we really work hard at training our staff and making sure they're ready to take the best care of your child. And
well, I can feel that as I walked through the door and I saw these smiling faces of these beautiful women here in the office, and I didn't just want to, I jumped around from toy to toy. It is a fun atmosphere and a welcoming one, and you feel safe.
and that's what we want. We want kids to feel welcome and safe and really at ease. The way the office is designed, it's designed for kids to kind of run and play and feel free, where their parents don't have to say, oh, get off the furniture, and all the corners in the office are nice and rounded, so it's kind of a safe place for them to run and just kind of let loose a little bit. So.
Well, you got to love that as a parent as well. So Dr. Doug, tell me a little bit about your experience and why did you get into pediatric?
Okay, well, first of all, I love kids, and the thing that's great about working with kids that every day is something new. They kind of keep it fresh. Anything that will happen with kids. So, I think, that's the main thing, is just wonderful working with children.
Well, and you're a wonderful dentist to be working with, so this is a good opportunity for you to check out Dr. Doug. Tell me where you're located.
We're located at 1300 North, 200 East in Logan, and we're just directly behind the Cache Valley Mall at the Logan Point commercial strip area.
And it's so centrally located. It was so easy to find in this whole strip mall right by the mall. Fantastic. And your phone number and website?
Phone number is 435-792-3033, and the website is drdougsmallsmiles@yahoo.com. Or excuse me, that's
your email?
That's my email. No, it's drdougsmallsmiles.com.
Okay, you can check them out. But you are the pediatric specialist.
You can email me too. It's fine.
Exactly. Drop him a line. Dr. Doug, thank you so much, and just enjoy the opportunity with your kids here. Then.
Thank you very much.
Bum bum bum